Dr. Jason West with the benefits of a chiropractic adjustment. Now, in this video, we're going to talk about what is a chiropractor, what do chiropractors do, what is an adjustment, what is the education of a chiropractic physician, what do chiropractors do or treat, and how often should I get adjusted? Now, doctors of a chiropractic, also known as DCs, care for patients of all ages with a variety of health conditions. DCs are especially well known for their expertise in caring for patients with back pain, neck pain, and headaches, particularly with their highly skilled manipulations or chiropractic adjustments. They are also care for patients with a wide range of injuries and disorders of the musculoskeletal system involving the muscles, the ligaments, and the joints. These painful conditions often involve or impact the nervous system, which can cause referral pain and dysfunction distant to the region of injury. So you can have a neck problem that refers down to the shoulder or down to the wrists or into the lungs, and the benefits of a chiropractic extend to the general health issues as well, since our body structures affect our overall function. DCs are counsel patients on diet, nutrition, exercise, healthy habits, and occupational lifestyle modifications. Are chiropractic treatments safe? Chiropractic is widely recognized as one of the safest drug-free, non-invasive therapies available for the treatment of neuromusculoskeletal complaints. And although chiropractic has been an excellent safety record, no health treatment is completely free of any potential adverse effects. The risks associated with chiropractic, however, are very small. Many patients feel immediate relief following a chiropractic treatment, but some may experience some mild soreness, stiffness, or aching just as they do after some form of exercise. Current research shows that minor discomfort or soreness following spinal manipulation typically fades within 24 hours. Neck pain and some types of headaches are treated through precise cervical manipulation. Cervical manipulation, often called a neck adjustment, works to improve joint mobility in the neck and restores the range of motion and reduces muscle spasms, which helps to relieve pressure and tension. Neck manipulation, when performed by a skilled and well-educated professional such as a doctor of chiropractic, is a remarkably safe procedure. Some reports have associated high-velocity upper neck manipulations with arterial dissection. However, the evidence suggests that this type of arterial injury often takes place spontaneously in patients who have pre-existing arterial disease. These dissections have been associated with everyday activities such as turning the head while driving, swimming, or having shampooing in your hair. Patients with this condition may experience neck pain and headaches that leads them to seek professional care, often at the office of a doctor of chiropractic or a family physician, but that care is not the cause of injury. The best evidence indicates the incidence of arterial injury associated with high-velocity upper neck manipulation is extremely rare, about 1 to 3 cases per 100,000 patients. This is similar to the incidence of this type of stroke among the general population. If you're visiting your doctor of chiropractic with upper neck or headaches, be very specific about your symptoms. This helps your doctor of chiropractic offer the safest and most effective treatments, even if it involves referral to another healthcare provider. When discussing the risk of any healthcare procedure, it's important to look at the risk in comparison to other treatments available for the same condition. In this regard, the risk of serious complications from spinal manipulation for conditions such as neck pain and headaches compare favorably with even the most conservative care options. For example, the most common treatments for the musculoskeletal pain and over-the-counter prescription non-steroidal anti-inflammatory drugs, or NSAIDs, and prescription painkillers are significantly greater than those with chiropractic manipulation. Over-the-counter prescription non-steroidal anti-inflammatory drugs and prescription painkillers are significantly greater than those with chiropractic manipulation. According to the American Journal of Gastroenterology, people taking NSAIDs are 3 times more likely than those who do not to develop serious adverse GI problems such as a hemorrhage or bleeding and perforation. That risk rises more than 5 times among people aged 60 and older. Moreover, the number of prescriptions for powerful drugs such as oxycodone and hydrocodone have tripled in the past 12 years, and the CDC has reported that the abuse of these commonly prescribed painkillers are among the leading causes of accidental death in the United States. Overdoses of opioid painkillers are responsible for killing 15,000 people per year. It's more than the number of deaths from cocaine and heroin combined. Doctors of chiropractic are well-trained and professionals who provide patients with safe, effective care for a variety of common conditions. Their extensive education has prepared them to identify patients who have special risk factors and to get those patients the most appropriate care, even if that requires a referral to a medical specialist. Does chiropractic treatments require a referral from a medical doctor? The answer is a referral is not needed to go see a doctor of chiropractic. However, your healthcare plan may have a specific referral requirements, and you may want to contact your employer, human resources department, or the insurance plan to find out if there are any referral requirements. but there are no restrictions on cash pay plans. And a matter of fact, you don't have to go to your human resource director or to your insurance company to get a referral to go to the gym or to get a toothbrush or toothpaste, but we know that's healthy, and so it is with chiropractic. Manipulative therapy helps a lot of conditions, and it may or may not be covered by your insurance. Most plans allow you to call and schedule an appointment with a doctor of chiropractic. Now, is a chiropractic treatment appropriate for children? And the answer is I've treated children in my practice for 17 years, and in our office we've treated children for 80 years before that. Yes, children can benefit from chiropractic care, and children are very physically active and experience many types of falls, blows from activities of daily living, as well as participation in sports. And injuries such as these may cause symptoms including back and neck pain, stiffness, soreness, and discomfort. Chiropractic care is always adapted to the individual patient. It's a highly skilled treatment, and in the case of children, it's very gentle. Now, are chiropractors allowed to practice in hospitals or use medical outpatient facilities? Chiropractors are being recognized to admit and treat patients in hospital systems and to use outpatient clinical facilities such as X-ray or lab for their non-hospitalized patients. And hospitals started granting privileges to chiropractors way back in 1983. Most insurance plans cover chiropractic care included in the plan, including major medical plans, workers' comp, Medicare, some Medicaid plans, Blue Cross Blue Shield plans, and federal employee plans, among others. Chiropractic care is available to active duty members of the armed forces in more than 60 military bases and is available to veterans at more than 60 major veteran medical facilities. Now, what type of education and training do chiropractors have? Doctors of chiropractic are educated as primary care health providers with an emphasis on the diagnosis and treatment of conditions related to the nerves, the muscles, the ligaments, and the spine. Educational requirements for doctors of a chiropractor are among the most stringent of any healthcare professions. The typical applicant for chiropractic college has already acquired a 4-year pre-medical or biology degree, has college education in biology, inorganic, organic chemistry, physics, psychology, and lab work. Once accepted into an accredited chiropractic college, the requirements become even more demanding. 4 to 5 academic years of professional study, and doctors of chiropractic are educated in orthopedics, neurology, physiology, human anatomy, clinical diagnosis, and laboratory procedures, diagnostic imaging, exercise, nutrition, rehab. Because chiropractic care includes highly skilled manipulative adjusting techniques, a significant portion of time is spent in the clinic technique training to master these important manipulative procedures. In total, the chiropractic college curriculum includes more than 4,200 hours of classroom time, of laboratory time, and a clinical experience. The course of study is approved and accredited by the agency that is fully accredited by the U.S. Department of Continuing Education. How is a chiropractic adjustment performed? Chiropractic adjustments or manipulation is a manual procedure that utilizes the highly refined skills developed during the DC's intensive years of chiropractic education. The chiropractic physician typically uses his hands or an instrument to manipulate the joints of the body, particularly the spine, in order to restore enhanced joint function. This often leads to resolve in the joint inflammation and the patient's pain. Chiropractic manipulative therapy is a highly controlled procedure that rarely causes discomfort, and the chiropractor adapts the procedure to meet the specific needs of the patient. Patients often note positive changes in their symptoms immediately following the procedure. Now, do the treatments need to be ongoing? The hands-on nature of the chiropractic treatment is essentially what requires patients to visit a chiropractor a number of times. And to be treated by a chiropractor, a patient needs to be in his or her office. In contrast, a course of treatment from medical providers often involves a pre-established plan that is conducted at home, like taking a course of antibiotics once a day or an antidepressant. A chiropractic may provide acute, chronic, and a preventative care, thus making a certain number of visits sometimes necessary. And I leave it up to the patients. When you see relief, then we want to make it so that you don't need continually intervention, but we want to make sure that you also don't slide back. It's a fine line by making sure that you're out of pain, but maximizing your potential and your ability to function in life. Your doctor of chiropractic should tell you the extent of the treatment and recommending how long it expects to last. Now, the last question that we have is, why is there a popping sound when the joint is adjusted? It may result in the release of a gas bubble between the joints, which makes a popping sound. The same thing occurs when you crack your knuckles. The noise is caused by the change of pressure within the joint, which results in the gas bubbles being released. There is usually minimal, if any, discomfort involved. I'd like to recognize the American Chiropractic Association providing information on this video. Wanted to tell you what a chiropractor is. There's extensive education that goes involved in that. It involves the interaction between the chiropractor and the medical community to help your health. And we've seen wonderful outcomes with chiropractic services in the West Clinic for the past 102 years.
Hey, thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, like, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.